Welcome to Pull Up with Limbs and Things. Happy August. This is where we bring you the information to confirm something you know, to challenge something you don't know, and to give you the opportunity to share it with others. Tonight, I will be talking to you a little bit about what's normal aging and what's really a warning sign. My name is Dr. Chanel James. I'm the owner of Limbs and Things, mobile and telehealth physical therapy practice. We serve aging adults in DC, in Maryland, and in Virginia. And our goal is to help you to move from I can't to I can. Today's question, is it getting older or is something actually wrong? We hear things like, I'm just slowing down. Everyone falls when they get older. I just need to be more careful. But tonight, we're talking about separating fact from fiction. Let's confirm something you know. So, many people already know that growing older does bring changes. As we age, we naturally may experience a gradual decrease in our muscle mass, slightly slower reaction time, and needing a little more light to see, and taking a bit longer to recover after a busy day, or possibly having a modest decrease in our flexibility. Those changes we can expect. But here's what many people do not realize: growing older should not automatically mean you give up your independence. So, I want you to take a moment, for those of you who are watching, and answer in the chat, is this normal aging or is it a warning sign? All right, here's the first one. Slower walking speed. Is that normal aging or is it a warning sign? I'll give you a few moments. All right, got an answer? Here's the answer. It is normal aging. Slower walking speed is normal aging. All right, pain that limits basic mobility. Pain that limits basic mobility. Is that a normal aging sign or is it a warning sign? Take a moment, put it in the chat whether you think it's normal aging or a warning sign. Pain that limits basic mobility. That is a warning sign. All right, here's the next one. Slower tissue healing. Slower tissue healing. Normal aging or is it a warning sign? Slower tissue healing. That is normal aging. All right. Altered temperature regulation. Altered temperature regulation, whether you're hot, whether you're cold, as you get older. Is that altered temperature regulation normal aging or is it a warning sign? It is normal aging. All right. The next one is inability to lift everyday objects. Inability to lift everyday objects. Is that normal aging or is that really a warning sign? Inability to lift everyday objects. Please put in the chat normal aging or warning sign. That is a warning sign. All right. Falling or fear of falling. Is that normal aging or is that a warning sign? Falling or just the fear of falling. Normal aging or a warning sign. You can put that in the chat. That's the last one. Falling or fear of falling is a warning sign. That is not normal aging. All right. I hope you got all of those correct. So now let's talk about challenging something many people believe is normal. Okay. First thing, I'm supposed to fall because I'm older. How many of you have heard someone say, I just lost my balance because I'm getting older, or I tripped the other day? The reality really is falls are not normal aging signs. Falls count for grabbing furniture, kneading the wall. You have a fear of falling. Any of those things that happen to you, even if you're tripping constantly and you find or look down and see that there's nothing really that you could have tripped on, then that means that you probably need a physical therapist. In someone's home, I don't just watch them walk. I look at how they move from room to room, how they get out of bed if they're there to begin with, how they step into the shower, how they navigate their stairs, do they reach for items safely? Those observations often reveal challenges that just don't show up during a clinic visit. All right, number 2, the person may say, I stopped doing things because I'm getting older. So then you have to ask, okay, did you stop going upstairs? In this area, we have laundry on our basement levels usually. Have you stopped doing your laundry? Are you having a child come over to assist you in doing so? Have you been someone who likes to garden and now, because of whatever reason, you have decided, okay, gardening is no longer for me. I can't necessarily get down on my hands and knees, or I'm not getting in one of those low chairs that helps me reach the ground easily. Perhaps you stopped going to church. You need a device now, or you're walking slower. Perhaps you stop shopping alone. You want to feel safer. You want to be independent, whether that means driving to a destination or whether that means that you are concerned about parking because of your depth perception. All of those things you want to be aware of as you get older. They could be signs that you really need to have some extra support to age well. Sometimes people stop activities because they are either adapting to pain, weakness, or they have balance problems. Not because those activities are impossible, though. They're just having more challenges in doing that. Please note that physical therapists often help identify these barriers and work toward improving your strength, your mobility, your confidence, and safety so that you can continue to participate in the activities that you find enjoyment from and that matter most to you. All right, number 3, pain is just a part of getting older. All right, some aches do occur with age, but persistent pain that is limiting your ability to walk, limiting your ability to sleep or get dressed, cook, play with your grandchildren or your great-grandchildren. All of those things, that deserves your attention because pain should never simply be accepted because you're getting old. Pain usually is a sign that something is wrong and it should tell you, okay, let's pay more attention to it. All right. So please view pain as something that is necessary to have, especially if something is needing more attention. Don't ignore the pain you're in. Okay. Number 4, I don't need help because I haven't fallen. All right, so let's discuss some warning signs. If you need, let's clarify. If you have been a person who has always stood without hand support and now you need 2 hands to stand, or you find that as you walk throughout your home, you're doing something we call as furniture gliding. You're holding on to furniture to walk through a path that you really should be able to walk through without holding on to anything. Or you're slowing down significantly, possibly avoiding showers because it's slippery, avoiding the stairs because it's too difficult to do, avoiding leaving home, or just becoming less active or less socially engaged. These are early signs that deserve attention before a fall occurs. All right, so I think this is a good opportunity for you to do a self-check, right? Can you stand up from your favorite chair in your home without using your hands? Can you do that? Are you walking less than you did, say, 6 months ago? Have family members told you that you're moving differently? Are you doing certain activities faster or slower than you were before? Because it's not just things that slow down. You could be doing them faster, and that's more of an impulse situation. So we want to make sure that you're doing it in a safe way, okay? If you answered yes to any of those questions, you probably should check with a physical therapist next week. If you are a caregiver, caregivers, you want to see the person who you're caring for. Have you noticed any changes that the person may be saying, oh, yeah, that's not a big deal? And then let's think about your home. I have the privilege of seeing people where they actually live. The home tells a good story. I will notice walkways, railings, porches, outside chairs, cars that have been sitting, rugs that can create trip hazards, whether your lighting is dim or whether it is a commensurate for the area. If you have stairs that you're using less often, you have favorite chairs that have become difficult to stand from, you have chairs on wheels. Um, Bathrooms that don't have grab bars, types of chairs, space to navigate them, kitchens where frequently used items are stored out of your reach, whether they're too high or too low. And these aren't just details, they can really affect your safety and your ability to be independent in your home environment. So, a home assessment can really uncover just simple changes that can support your daily function and reduce your risk of falling. All right. We know as we get older, I watch a lot of shows that tend to be related, I guess, because I am in this space a lot, to older adults. And the main thing that people fear is falling. And the falls, because they lead to a ripple effect. The person goes into the hospital, they could possibly have a fracture. That fracture ends up becoming something that affects them systemically. And all of a sudden, there's a loss of life. That's now a horrible situation, worst case scenario. However, the person thinks in their mind, okay, this fall is fatal. So that's why we want to make sure that we address it as quickly as possible so that that does not become your reality. Excuse me. So 3 takeaway points. I want you to know growing older is normal. Giving up should not be. All right. You don't want to give up your independence. There are so many ways that you can continue to do your very best in moving. And we want to make sure that you have as many strategies as you can that can help you continuing doing what you want to do to the best of your ability, because that's what matters most. And please don't wait for a fall. Pay attention to changes like slowing down and moving. If you're having driving difficulty, if you're becoming socially isolated, or you're avoiding activities that you like, anything that's decreasing your confidence, you want to address these as early as possible so that you have the best outcome. Movement really is medicine. So staying active to maintain your strength, your balance, your endurance, ultimately improves your confidence and, of course, your independence. What I find in a lot of older adults is, yes, I can train you strength wise, I can train you balance wise, I can even train you cardiovascular wise. However, your confidence in yourself is what matters most. And I always tell people 50% of what we do is physical, but the other 50% is mental. If your mind is not there, if you are not mentally ready to make the change that you have to make, this is going to be a real hard uphill battle. And we've got to conquer the mind before we can move forward functionally. So even small improvements can make everyday tasks easier for you to do. So please test yourself so that you continue to age well. Here's a few tests that you can do this week so that you will know how well you're moving. The first one is to make sure that you are able to sit and stand from a chair with the least amount of assistance as possible. If that is hard for you to do, you want to continue to train yourself so that you can do that to the best of your ability. There is a test, the 5 times sit to stand test, or seeing how many stands, full stands, you can do in 30 seconds. And you can look this information up based on your age and see what the normal range would be. That is a good way to assess your strength of your lower body, but also to determine how well and how safe you stand and your balance control when you come to an immediate standing position. Turning, standing immediately. Those are classic things that we work on in physical therapy just so that you can move better, especially as an older adult. You'll see people who don't necessarily get close to a seat. They'll try to be far away and then fall into the seat. That is not the best way to do that. And it will eventually create a problem that can lead to a fall. So we want to do the things that we can to prevent a more serious situation. All right. If you do have a question, you can always put it in the chat. Take this opportunity to share this information with someone else today. Remember, Pull Up with Limbs and Things is to confirm something you know, challenge something you don't know, and give you the opportunity to share it with someone else. So if today's conversation has encouraged you, please share this episode with maybe your parent, your grandparent, your neighbor, your church member, or your caregivers. Because at Limbs and Things, we're committed to helping people move from I can't to I can. Until next time, I hope you keep moving, you keep learning, you keep lifting, and help us to continue to age well by doing these things. Have a good night, everybody.